Hello, my name is Nathan Davis, and I'm a current student at Gaston Community College, and I'm going to school to become a registered nurse. I'm doing an oral presentation on a recent research document that I've done, and the title is Staph Infection Prevention. Staph infections have been a problem in the healthcare industry for many years now, and even though there are universal precautions set in place that are to be followed, still somehow the different bacteria keeps popping up and keeps spreading throughout healthcare facilities. In this presentation, I would like to present a few different ways in which this could be reduced. But before I get into that, I would like to kind of touch base on what staph infections really are. Now, staph infection is caused by bacteria, and staph is actually short for the scientific name Staphylococcus. Now, although there are over 30 different strands of this according to Medline Plus, the most common one is Staphylococcus Aureus. And there are very many different staph infections that come from this, but some of the most common ones are skin infections, and stuff such as pneumonia, blood poisoning, and MRSA. MRSA is probably the most common one of these. The CDC, or Center for Disease Control, states that MRSA skin infection can occur anywhere. However, there are different factors in which can make this much more prone to happening. And they categorize these factors in what they call the 5 C's. And the 5 C's are as follows: crowding, frequent skin to skin contact, compromised skin, which would be cuts and scrapes, contaminated items and surfaces, and lack of cleanliness. Now, locations where these 5 C's are most common are going to be schools, households, military barracks, correction facilities, daycares, a lot of different places. The Occupational Health and Safety and Health Administration, or OSHA for short, states that Methicillin-Resistant Staphylococcus aureus, or MRSA, is a type of staph bacteria that is resistant to certain antibiotics, which include methicillin and other common antibiotics, oxalicillin, penicillin, and amoxicillin. The healthcare associated staph infections include surgical wounds, different infections, urinary tract infections, and bloodstream infections. And although hospitals are like a greenhouse breeding ground for bacteria, there are several ways in which staph infections and MRSA can be prevented. And one of the ways that I'm actually going to mention 3 different ways. The first one is new research. There was a research put out in 2003 that was done and funded by the federal government, and it was provided through different people from several different universities and from the CDC. And the title of this was Reduced MRSA Trial. And in this they used over 75,000 different patients in 16 different hospitals across the United States. And I will include a link to that and in my citations. Also, following universal precautions. This is something that's already been put in place by the CDC and should be followed a little bit more closely than it actually is. My third thing to mention is healthcare workers and professionals should maintain a healthy and fit lifestyle outside of their job, because the staph infection and staph bacteria rarely affects those that are healthy and have a good immune system. So in my conclusion, there are several different ways in which this bacteria can be reduced, And I think that including some new research and following the guidelines put by CDC and also maintaining a healthy lifestyle would prevent and reduce this staph bacteria spreading throughout hospitals and other healthcare facilities. I will include my citations and references after this video. Thank you for watching.